Hi, my name is Dr. Maggie Augustyn, and I'm a general dentist here in Elmhurst, and I am going to explain to you how to take pain medicine to maximize it so that you feel the least pain possible. Now, most people think that the best way to take pain medicine is by asking for a narcotic, so something like Vicodin or Norco or codeine. Studies actually show that alternating between ibuprofen or Advil and Motrin, those are the other two names that are ibuprofen, or acetaminophen, another name for that is Tylenol. So alternating between the two of them in literature, in scientific studies, it shows to be equally or more helpful than taking something like a Norco, Vicodin, or codeine. So I very rarely prescribe controlled substances because they are addictive. So the way that you take these for maximum benefit is you start with taking ibuprofen and you take 600 to 800 milligrams of that. Now, 600 to 800 milligrams would be between 3 or 4 pills of that. If you take any more than 3 or 4 pills of that, you will not gain any more benefit. So that means that if you take 10 pills, you will not feel any better than if you take 3 or 4 pills. In fact, you can overdose and die on that. So, and then the most that you want to take during a 24-hour period is 3,200 milligrams, which is 16 pills. Do not take any more than that in 24 hours because you can overdose and you can possibly die. So you would take that, and then about 2 to 3 hours later, okay, you will take acetaminophen or anything Tylenol and you will take 500 milligrams of that. You can take up to 1,000 milligrams, which will be as much as 2 pills. Now, 500 milligrams is extra strength. Regular strength is 325 milligrams. Do not take more than 1,000 milligrams at a time. And the maximum dose for that is 3,000 milligrams per day. If you take more than 3,000 milligrams per day, once again, you take the risk of possibly overdosing and dying. And then, so you will take that, let's say at noon, you would take that at 3 o'clock. At 6 o'clock, you would go back and take the ibuprofen. At 6 o'clock, you would go back and take the acetaminophen, and you switch these back and forth every 3 hours. And that's how you get the most benefit. Now, some people wait for the pain to come before they take medicine. Do not do that. Take the medicine before the pain comes, because once the pain start coming, you start to release the chemicals in your brain that tell your brain to feel the pain, and that's when managing the pain gets a little more difficult. So those are some of my tricks of the trade to make sure that you are as pain-free as possible for as long as possible.